The pain, the pressure, the congestion and headache. For some chronic sinusitis sufferers, there is never a time when they're actually free of the symptoms, and it affects everything in their life. Well, joining us today, we have a Dallas doctor, Dr. Rajiv Pandit. He's going to tell us about one option to relieving some of those symptoms. And also, we have one of his patients who's actually been helped by this procedure. First, kind of tell us, how is sinusitis different from allergies? Because a lot of us get those two things kind of confused, what we're actually dealing with.
Sure. So when people have allergies, they usually have symptoms such as itchy nose, sneezing, congestion, and postnasal drip. However, when those symptoms persist and you also have facial pressure, pain, fatigue, and a malodorous discharge, then you're talking more of sinus blockage. And that's when visiting an otolaryngologist or an ear, nose, and throat specialist is worthwhile.
And kind of tell us, is there a time of the year when these symptoms are more prominent than others?
Generally in Dallas, it's spring and fall. Dallas is one of the top 3 worst cities for allergies in the country. So for many people, it's year-round, but generally it's spring and fall for most people.
And the reason why we have you here this morning is you're going to tell us about, it's a minimally invasive procedure. It's called the sinus balloon. Tell us about this procedure and what does it do?
Sure. The balloon sinus dilation procedure is very innovative, and it's a fantastic option for people that want a minimally invasive approach to sinus surgery, which traditionally was done in the operating room under anesthesia. Now we can do it in the office, and people go back to work the next day, and I've had people even fly internationally the next day. So it's a great way to relieve the pressure, pain, and blockage that many people have had for months or years.
And how do we know if your symptoms are actually bad enough to seek this kind of treatment?
Well, if you've had facial pressure and pain for over 2 to 3 weeks, it's time to see an ear, nose, and throat specialist, and at that point you would be a candidate for evaluation, and then a CAT scan and sometimes an evaluation of the nose will determine if the sinuses are blocked enough for this procedure. And
we have Elizabeth with us, and she
Yes.
is going to talk to us about, you went through this procedure and how did it help you?
Oh my goodness, it was night and day. I came in with actual dental pain on my right side. I'd been to 2 different dentists, and the second one finally said, you have really low-lying sinuses. I think that this is a sinus problem. So I saw Dr. Pandit, and after I had the procedure done, I haven't had any dental pain since then. And I can breathe through my nose. I can, it's been really good.
Life-changing, huh?
Yeah, really.
Because when we were talking here in the studio, a lot of us have these problems. I know when I have a sinus headache, it's like it will take me down for maybe 2 days. Is there any over-the-counter thing that anyone can use that helps a lot of people?
Sure. So one of the best things is actually not medication, it's actually steam. So personal steam inhalers are very popular because what you want to do is you want to drain all the blockage so that you don't get recurrent infections. So I prefer steam inhalers, and Mucinex, which is a great over-the-counter product that also allows sinuses to drain, is another excellent option.
All right, well, we appreciate both of you joining us here this morning, Dr. Pandit and as well as Elizabeth. Glad you're feeling better, because I definitely can identify with that pain. A North Texas man